Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, here to answer a few more questions that you may have about feline cardiology. And I have some questions that have been presented.
Dr. Lucas, what do I need to look for as a first sign of a heart issue in a cat?
First sign may just be, we call it ADR, ain't doing right, just more lethargic, increased respiratory, maybe rate and effort, just maybe positioning themselves in a little different way where they kind of put their little paws maybe up underneath them, like instead of like folding them in, they'll just sit with their little paws underneath their little chest and just kind of just sit with their neck a little extended. Just something that catches your attention is just, hey, something's not right here.
Do I need a board certified cardiologist to diagnose heart issues in my cat?
Great question. So we do in veterinary medicine have board certified veterinary cardiologists, and we're super happy to have them. We do not, however, have to have a board certified cardiologist directly involved and be able to diagnose your cat with heart disease. However, it is a great partnership that we have. Day practices often have the ability through telehealth or telemedicine to be able to partner with a veterinary cardiologist to be able to diagnose your cat. So we do think they're very important to pull into feline heart disease early on so that we can get the proper diagnosis and treatment started with that partnership.
Let's talk about heart murmurs, how they're diagnosed.
Yep. So a heart murmur simply means that the heart valve is not closing entirely correctly all the way. So you have a heart valve normally closes tightly just like a regular valve, but a murmur, there's a little bit of gap in that valve and that blood is going the opposite way instead of just going one direction. There's a little jet of blood that goes the opposite way, and veterinarians, we hear that as turbulent flow in the heart, and that leads us to hear a little psh, psh, psh sound. And we detect that when we listen to your cat's heart through our stethoscopes.
What does an echocardiogram show that an X-ray doesn't?
So if we detect a heart murmur, we may or may not decide to work that patient up, but oftentimes we will want to get a little bit more information on that cat's heart through maybe a cardiac enzyme called a proBNP, or we might recommend to do some chest x-rays or even an ultrasound. So the difference between chest x-rays and an echocardiogram, which is an ultrasound of the heart, is when we do an x-ray, we see the lungs and we see our hearts, and we can measure the heart size, but we can't look into the heart to see the valves, we can't see the chamber sizes or the thickness of the muscle, we just can see the overall size of the heart through an x-ray. Where an ultrasound will actually be able to diagnose the type of heart disease that your cat may have, or tell us that we have a nice, beautiful, normal heart and all the valves are closing normally. But that's the way we truly get our diagnosis, is through an ultrasound of the heart called an echocardiogram.
How long can a cat live with heart issues?
So it's a pretty wide variability of lifespan after diagnosis of heart disease. We do have a subset of cats, unfortunately, usually those younger adult males that get diagnosed with hypertrophic cardiomyopathy, which is called HCM for short. Hypertrophic cardiomyopathy means thickness of the heart muscle, and the chamber sizes get smaller. And with that disease process, the heart has to work really extra hard to circulate blood, and those cats are more at risk for thromboembolisms, which are blood clots that occur within the heart and then get released into the bloodstream and can cause a catastrophic event to the point of sudden death. That can happen at any time with a hypertrophic cardiomyopathy patient. We try to prevent it through blood thinners and some other things to slow the heart rate down, but the reality is that some of those cats will die very early. That being said, we do have a whole subset of cats with hypertrophic cardiomyopathy that do go on and live a very long life, and ideally, they can actually live into their later senior years. So it's not the best for you to hear that your cat has heart disease or even hypertrophic cardiomyopathy. but with education and regular follow-ups, and we also do repeat ultrasounds on those patients, we can actually follow that heart over time and have some conversation about that heart disease with you and be able, so you might be prepared if something is worsening, that we know that where that heart is going. But lifespan is really dependent on the severity of the disease.
What heart conditions are considered treatable in cats and which are not?
Yeah, so hypertrophic cardiomyopathy is one of those sort of curative diseases or treatable diseases. We can do some things to help the heart. We can slow that heart rate down with bradycardic medications. Usually like atenolol would be one of those that most pet owners might have heard of. We can measure blood pressures and maybe use some amlodipine and reduce blood pressure, but we can't really change the way that heart is diseased, so that's not very treatable. We do have a subset of cats that will go into congestive heart failure. Again, we can't turn back the clock on that heart, but we can actually introduce medications to treat it. And then there's some cats that just have some secondary diseases, such as like hyperthyroidism, that will affect their heart secondarily. If we treat that hyperthyroidism, we can actually improve the cardiac health. So that is a secondary disease process that improves with treatment of another one. So those are a little bit more optimistic if your cat has some secondary cardiac disease related to another disease in the body. So if you feel like your cat has some heart disease, or you have a prior diagnosis and feel like maybe you need some more partnership, we would love to talk to you about your cat and their heart health. And if you'd reach out to Blue Oasis Pet Hospital, we'd love to see you. Thanks.